is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon. So today I'm going to talk about one problem we sometimes see after surgery that can be pretty terrifying for patients. Typically about 2 weeks after surgery, we may get that phone call and it's like, help, my incision is opening up. So first of all, this problem, wound dehiscence, just basically means when the wound opens up by itself, is a lot more common when patients have undergone a bigger surgery like abdominoplasty, particularly if the patient is on the larger side to begin with, top surgery in larger guys, breast reduction, that sort of thing. It would be more common in. If it's going to happen, it typically happens maybe a week or two after the original surgery, and it can be kind of scary. And oftentimes patients are surprised by our response, because what we never do is bring you back to the operating room to close the incision, because one, we would trap some infection in there, and two, it's going to open right back up again. We got to let the body do its own thing. And so sometimes what we do is kind of clean up the area, but then we just teach the patient how to do wound care. But what I'm always more interested in around this time is, why is this happening to this patient? What are the risk factors this patient has, and can we help improve upon anything? Because that's how we're going to get good wound healing and a good outcome for this patient. So I would say in my practice, probably the top 3 things that lead to wound dehiscence. Number 1 would be diabetic patients. Diabetic patients have a hard time healing wounds. It's just more difficult. And what we do know is the higher the patient's blood sugar is around the time of surgery, the worse things are. So what we would like to do is check that hemoglobin A1C before surgery, make sure it's optimized, make sure the patient's diet is good, if the patient is on insulin, that their blood sugars are well controlled. And this will help. So that's one thing we can modify if we pick up on that. The next thing, the next risk factor I would say we see sometimes in patients is after surgery, a patient may not feel like eating, or they may decide that now's a good time to start fasting. And I've seen it a couple of times in patients that they're like, Doc, I lost 15 pounds, like in the 3 weeks after surgery, which makes me very nervous, because that patient needs the building blocks to repair this large wound, particularly protein. So in patients who've maybe lost their appetite, protein shakes are super important, because you do need those building blocks, or things are going to kind of, for want of a better word, fall apart. And then the third reason, probably the most common culprit, is the patient is smoking, or they're passive smoking because they're surrounded by somebody who's smoking, by cigarette smoke from somebody else. So this is a huge one. Smoking after surgery is a big no-no. There's carbon monoxide in there, there's nicotine in there. None of it is good for wound healing, and we need to cut that out, particularly now if the wound is at this point opening up. So once we've addressed those risk factors, next thing we're going to want to do is some wound care. Your doctor will advise you on this. And what I find is, in the long run, as scary as it can be initially for a patient when an incision opens up, 1, it tends not to be too painful, and 2, it tends to be quite forgiving. So the patient, depending on how well we're able to modify those risk factors, may be doing wound care for several weeks, but the wound will eventually contract down and be a raised red wound for a while, and then in the long term, it tends to be quite forgiving. So I hope this helps explain what's going on when incisions start healing up or opening up. It can be a scary time, and good luck.